Assalamu alaikum. Peace be unto you. This was the greeting that I was met with every single day as I walked into work at the Assistance Coordination Unit this summer in Gaziantep, Turkey. And at first the irony kind of missed me, I didn't catch it, that we would start the day talking about peace and then go on throughout the rest of the day talking about conflict and its effects on infectious diseases. But we did share in some very beautiful, very peaceful moments. This is a scene from a picnic. This is definitely one of the perks of living in Turkey for the summer. There's a lot of barbecues, great food, great company, and colleagues quickly became close friends. And as I got to know them and I got to learn about their experiences, it hit me the audacity of talking about peace and working on peace in that situation. The courage that it takes to not only greet people with peace, but also work on it. Because the people I was working with, they were physicians from Syria that had escaped to Turkey, and they were escaping scenes like this one. So this is the aftermath of a strike in Aleppo near a hospital called Omar ibn Abdulaziz Hospital, also known as M2. And so this is one perspective that people might get familiar with. They see it on the news. But here's another angle of it. This is an aerial photograph taken on August 5th, 2016. And if you look over here, some buildings adjacent to the hospital. So the hospital is this building right here. And you can see that in one strike between August 5th and August 10th, that the buildings are completely demolished, and that by the end of the year, the entire neighborhood and community actually is affected by this. And so there's a lot of residential areas demolished, the hospital itself is damaged beyond repair, and the hospital was forced to close down, even though it was one of only 3 ICUs and the only pediatric care center in all of Eastern Aleppo at that time. This hospital was actually struck 14 times in 6 months, and this is just one hospital in one neighborhood in one city in Syria. The Syrian American Medical Society and Physicians for Human Rights documented and confirmed at least 600 different strikes on medical facilities between the start of the war in 2011 and 2016. And now we're in 2018 and it hasn't stopped. And over 815 healthcare workers have been killed up to that point as well. And so this is another perspective from the inside after one of these strikes. You can imagine a patient lying on one of these beds, a nurse or a physician attending, not aware of the impending strike. But the consequences go far beyond just broken brick and mortar. There's consequences on a systemic level for public health. So some of these consequences include the reemergence of infectious diseases that were previously eradicated, like polio, or nearly eradicated, like measles, mumps, or cutaneous leishmaniasis. That's a difficult one. And so these are very difficult, severe problems to grapple with. And so in 2013, Syria actually faced polio epidemic. They hadn't seen polio for 15 years, and then all of a sudden polio pops up, and there was no one watching at that time. And so what happened was it took a long time to even detect that this was happening. It took a long time to understand how it was spreading. It took a long time to mount a response and make like a proper vaccination effort. And so what happened was in that aftermath, the Assistance Coordination Unit where I worked, the ACU, began a surveillance network and response team. And so these are some of the brave souls that have remained inside of Syria to do that work. Syria, after the aftermath, after all these conflicts and attacks on healthcare centers, there's a lot of different challenges that healthcare centers face. So there's lack of access for patients. Patients have to travel hours to get to the nearest facility. And when they get there, they're always under this constant fear that they might get struck. There is the lack of primary healthcare sources and disruption of routine services like primary healthcare and also like vaccination services. There's the shortage of supplies and medications. Syria used to actually produce 70 to 90% of their pharmaceutical needs. And now that's down to a trickle, so there's no medications basically. And there's also healthcare worker flight. A lot of people have left the country. Between 2011 and 2015, over 50% of physicians, Syria before the war had 30,000 physicians, and by 2015 they had less than 15,000 physicians left. And that number keeps dwindling. And so this obviously faces a lot of challenges, but these are some of the people who have stayed behind to not only provide care and vaccination efforts, but also to collect data for surveillance efforts. And so they operate mostly in opposition-controlled regions. There's no central government that like in those areas, so there's no central healthcare system. So no one's looking or keeping track of these infectious diseases until they started doing their work. Of course, as the conflict has progressed, the maps have shifted, but their work still remains. And their efforts have been very, very critical to not only identifying key infectious disease outbreaks and epidemics and providing responses to them. One of them was, for example, a polio outbreak, vaccine-derived polio in 2017, and they were able to mount a much more efficient response than the one in 2013. And there's also an ongoing measles epidemic and many, many other cases where there's uncontrolled infectious diseases that would have beforehand taken a long time to respond. Now they have a much more efficient response system. And so these are more members of that very same team. And I don't think that the importance of surveillance in conflict settings can be overstated, because not only are we able to track infectious diseases in those areas and then provide a better response and a quicker response, but we're also able to better triage our limited resources in those settings and mount more effective responses. And at the same time, it gives us a very rare window into the effects of conflict and war crimes on public health. And that's something that you don't usually get in a conflict setting. And so this provides us, as we continue to unravel and learn about these connections and the relationships between these things, we can learn about not only how to respond, but also how to be proactive as we identify population-level trends and risk factors, which is very important for future conflicts, as well as this conflict over here. And hopefully it can also contribute to the mounting body of evidence of war crimes and the effects of war crimes on public health. And so, surveillance is definitely not the solution to conflict or the results of conflict, but it's a very important tool, a very major tool, and it's also an important step towards peace. Thank you. Assalamu alaikum.
As many of us know, today as we sit here, there's a caravan heading north from Honduras, making its way towards the northern border of Mexico with the United States. And the caravan consists of mothers, fathers, kids, all sorts of people fleeing home, fleeing from violence and conflict, seeking asylum in new places. We know that these people are going to experience all sorts of challenges along the way. Levi did an excellent job this morning highlighting some of the challenges that people who might resettle in Mexico experience. We know already that many have been detained, thousands have returned home, and in fact, it's been reported that several have already been killed. But by the time it arrives at the northern border of Mexico, only a fraction of those who initially set out with the caravan will remain. And it's there that those who are seeking asylum will turn themselves over to the custody of U.S. Immigration Enforcement and California Border Patrol, and they'll join tens of thousands of other migrants detained in detention centers across the United States. As a public health scientist, I'm interested in the intersection of health and justice. And I was curious to know, what is the health and mental health impact of these detention centers on asylum seekers? And so through the opportunity provided through this fellowship program, I initiated a qualitative research study based at UCSD, and I interviewed asylum seekers who were granted asylum here in the US who have resettled in California, and I asked them to share with me their experiences navigating the US immigration system. And so today I'd like to share with you some of the preliminary findings through a summary of their shared experiences. Their stories begin in a variety of places. Most began over 2 years ago. Some were fleeing from political oppression, others from gang violence, some traveling in large groups, others traveling alone, all experienced conflict along the way. But the one thing they had in common is, from those I spoke to, their stories all intersected in Tijuana, Mexico, which is where they first encountered barriers established by the U.S. immigration system. And they experienced that barrier in the form of California Border Patrol refusing asylum seekers their right to declare themselves at the port of entry and enter the United States. So by preventing entry initially to asylum seekers, California Border Patrol is able to establish a proverbial wall that prevents asylum seekers from entering. And so after months of travel, for some even longer, with depleted resources and weariness, they are left in Tijuana for weeks, sometimes even months, searching for food and for shelter. And for those with medical conditions, diabetes, pregnancy, chronic migraines, etc., this is a particularly challenging time because there's little to no health resources available for this population. I spoke to one man who, back in his home country of Guatemala, was a police officer, and he was targeted by the gangs and they tried to take his life. He was run over by a vehicle when he was on his motorcycle. And after several life-saving surgeries and a dramatic journey north, he was forced to spend 3 months in Tijuana before he was allowed to declare for asylum. And during this time, he struggled to access essential medicine like pain relievers or medicine to prevent seizures. But eventually, once asylum seekers are allowed to enter California Border Patrol custody, they become detainees. These are some abuses that have been documented for years, but these are still experiences that asylum seekers and other migrants experience today. There is a medical screening at this point, but there's no specialized care offered, and people spend 1, 2, up to 3 or 4 weeks in California Border Patrol custody in a large, uncomfortable room with limited access to food, and bedding and space is deficient. So after spending weeks in this room, eventually they'll be handed over to ICE custody, that stands for Immigration, Customs, and Enforcement, and it's at that point that many are separated from family members or travel companions. The ICE detention centers are managed mostly through private corporations, and a lot of the people I spoke with referred to them as las hieleras, or the ICE box. And that refers not only to the fact that they're managed by ICE, but to the notoriously frigid temperatures that every single person I spoke to complained about. In the detention centers, asylum seekers settle down for a much longer stay, for many a minimum of 6 months, but for some that I spoke with, up to years in the detention center as they await for their asylum hearing. Daily life in the detention center revolves around meals, work schedules, and a singular hour of recreation in the afternoon. Most I talked to reported getting sick at least one point. The food was miserable. And for those who worked, which was everyone I spoke to, they were compensated $1 a day, basically running the detention center by cleaning facilities and preparing food. Some I spoke to didn't want to work, but they were forced to under the threat of write-ups by the guards. And these write-ups can result in solitary confinement, or that they've been threatened to impact their asylum hearing. So everybody in the detention center works. And the singular hour of recreation in the afternoon, while it's looked forward to, it does very little to relieve restlessness that people experience in the detention centers. For most asylum seekers, the detention center is analogous with stress and depression. In addition to the daily grind that they experience due to life in the detention center, the asylum seekers reported to me the additional impact on their mental health that they experience due to things such as being separated from their families, stress related to their asylum hearing, and threats and intimidation by the guards. Everyone reported various levels of impact. Some talked about feelings of dehumanization, demoralization, and 2 people I spoke with explored suicidal ideation. And this is among asylum seekers who are otherwise known as a very resilient and very determined group based on the experiences that have got them to this point so far. As for medical resources in the detention center, they are available to those who need it. There's a waiting list that you can sign your name and wait to see a doctor or a nurse. However, this can take hours, and sometimes the wait can last overnight. One man I spoke to passed out while waiting for pain relievers, and another man spent an entire day throwing up before he was able to see a nurse. And surprisingly, many people actually experienced unwanted medical attention. The man I told you about earlier, who had extreme medical conditions based on his previous injuries from his home country, he was forced to give blood early in the morning. He was woken up, and he was not explained. They did not explain to him why they were taking his blood, and he was threatened with write-ups if he had refused. One woman I spoke to received an injection, and it wasn't clear to her what was in it, and she did not want it in the first place. So the accumulation of health and mental health experiences in the detention centers is vast. But eventually, after credible fear interviews and years or months in the detention center, asylum is granted, at least among those whom I spoke with. And they're released from the detention center. Often, this takes place in the center of in the middle of the night, which I find it hard to believe is coincidental. And they're free to move about their new home country, asylum granted, free to struggle to find food, struggle to find shelter, and for some, just hope for healing with no connection, no referral, no continuation of care for their medical needs. So what's the purpose of all this? It's more than just storytelling and sharing tragic anecdotes. I am conducting and analyzing dozens of structured qualitative interviews for the purpose of establishing scientific evidence to be published in an academic journal to document the specific ways, more specific than I was able to share with you today, the specific ways in which detention centers create harm, mental health and physical health, to asylum seekers. And with this data, we plan to advocate for human rights and give voice to asylum seekers in designing and improving public health programs, both here in California and in Tijuana, to mitigate some of the harms caused by our detention centers. So what can we all do to help? There's a variety of organizations already working with asylum seekers and migrants, and together, through research and advocacy, we can work to restore justice and health for those who are seeking asylum in the United States. Thank you.
Hi y'all, good afternoon. My name is Bernadette Lim. Thank you for being here today. Today I'll be talking about a pressing issue that hits home for many here in the East Bay: sexual exploitation and sexual harassment. Yet beyond naming this issue in this presentation, I'll be presenting a vision for the future, as I hope to have this presentation elevate the voices, experiences, and work of young women of color themselves. This talk is entitled #SayTheirNames, addressing sexual harassment and exploitation of young women of color in Oakland, California. On July 22nd, 2018, 3 African-American girls and sisters, Nia, Latifah, and Tashia Wilson, were attacked by a knife-wielding suspect after exiting a BART train at MacArthur Station. Latifah and Tashia Wilson were left in critical condition from the attack, and Nia, the youngest of the 3, unfortunately passed away after being slashed in the neck. Nia was only 17 years old. She recently graduated from Oakland High and was on her way to have her first job interview the week she was killed. The attack on the Wilson sisters and Nia Wilson's tragic death has left yet another family and the greater Oakland community in hurt, rage, and in demand for answers on why public safety for young women of color is still not a priority in the Bay Area. And many claim that the answer of public safety is simple for young women. Don't stay out too late. Go out in groups. Don't wear skimpy clothing. Avoid streets like International Boulevard. Yet what happened this past July to the Wilson sisters is evidence that such attempts to censor and police women's presence and bodies in public spaces cannot prevent violence and death that results from harassment and exploitation. Harassment and exploitation against young women of color can no longer be neglected because women of color face harassment and assault at higher rates than white women. According to a recent National Domestic Violence Survey, 60% of Asian Pacific Islander women, 23.4% of Hispanic Latinx women, and 37.5% of Native American women experience intimate partner violence in their lifetime. Black women experience intimate partner violence at a rate 35% higher than that of white females, and about 2.5 times the rate of women of other races. We must address long-standing issues and fears of harassment and exploitation faced by women of color that have long been neglected by public discourse and action. Young women of color deserve to feel safe in the streets of their own city and live life to their fullest. As a human rights fellow this summer, I created a program for young women of color ages 14 to 18 called We Are the Ones We've Been Waiting For, a health education and arts initiative based in downtown Oakland. Together, young women spent 8 weeks using photography, poetry, and storytelling as a platform to explore health topics and community health issues such as mental health, public safety, healing, and self-love. And each week was a space for girls to learn and share new insights and group conversation about these issues. Mary, a participant, told me, she said, "Bernie, I've never had a chance to just talk about my feelings and learn that I'm not alone in the mental health issues that I face." And yes, the attack on the Wilson sisters and Nia Wilson's death really did hit hard for many of them. Sasha, a participant, told me, "Bernie, I don't go on BART because of this reason. I will never feel peace or safety even in my own city. And many agree. And during my one-on-one check-ins, Bessie, also a participant, said to me, "It's just this accepted, normal thing that we always have to watch out for ourselves more than other guys." As part of a final group project, girls created an art exhibition with their photographs and poetry to display to the greater Oakland community at Lucky Duck Bicycle Cafe near 12th Street BART. Alongside their artwork, girls also came up with their own list of demands called a 10-point platform by and for young women of color in Oakland, modeled after the Black Panther Party 10-point plan. The 10-point platform by and for young women of color is as follows. 1, we want respect and non-judgment of our appearances. We want to live in an environment free of catcalling and harassment. We want to live in a world that does not shame or police our bodies. 2, we want male allies who don't mansplain. 3, we want sisterhood because of shared identities, struggles, and triumphs we face and overcome. 4, we want fairness and equality. 5, we want to feel free to have choices. 6, we want a less stressful school system. 7, we want bathrooms that provide free period products. 8, we want more women in leadership. 9, we want to feel safe outside and while walking down the streets in our community. And 10, we want community-based safety and protection for our neighborhoods. City council members and local community organizations have already taken notice of this 10-point plan, and soon this exhibit will be at the Oakland Public Library in January 2019. And as we hear these powerful demands, I am reminded by Arundhati Roy's famous quote, "There is no such thing as the voiceless, only the deliberately silenced and the preferably unheard." In addressing issues of harassment and sexual exploitation, we must remember, young women of color are not voiceless. Rather than simply repeating decades-old advice to young women that has avoided any institutional change, we must 1, center young women of color, 2, ask young women of color, and 3, amplify the voices of young women of color. We must ask young women of color directly the changes they want to see in their community of Oakland, for they are the ones who live and experience such harassment and exploitation every single day. And so in honor of Nia Wilson, the Wilson sisters, and the many women who have endured such violence, we must no longer accept violence, grief, and loss of life as the unchallenged norms resulting from sexual harassment and exploitation of young women of color. Now is the time to say their names. Now is the time to listen. And now is the time to act. Thank you.
Hi, my name is Seigi, and I'll be talking about the human right to water and how it exists in California today. Before we start, I want to ask, assuming that most people are from this area, how many people drink the tap water in the city? I'm being totally facetious, and I think it's absolutely okay and preferred that you do drink the drinking water here. But I do think that it's important to realize and highlight that before we start talking about this and talking about how, say, the UN at an international level recognizes the human right to water, and even California in 2012 became the first state to realize or to legally acknowledge this human right to safe, clean, affordable, and accessible drinking water, there's a lot of people in our state who actually don't have that. And this is a photo that I took 5 years ago, at a nonprofit called the Community Water Center in Visalia in Southern California. This is a pipeline that was in a community called Plainville in Tulare County, that in its previous life was actually used in an oil field to cart oil. And it was, unbeknownst to the residents, used to, or adopted to cart drinking water instead for a while. And through advocacy, they were able to get that out of the ground, but this sort of situation exists in many other places. myself growing up in the East Bay area, I never really had to question what it meant to turn on the tap and get water in my bathroom at my own convenience. But I do think that it's important that we sit with the reality that we here on indigenous land enjoy water from 138 miles away, also from indigenous land, going through all these other disenfranchised communities that actually aren't privy to this human right. So 6 years after this human right to water was realized in California, branches of the government like the Office of Environmental Health Hazard Assessment are now trying to quantify and assess how this human right is being realized at the statewide level. And one of the ways in which they're doing this is by looking at the monitoring and water quality violations that water systems are receiving. So if I take a step back, the way water sort of exists, very generally speaking in California, is that we have these public water systems that are regulated by a regulatory agency called the State Water Resources Control Board. And the State Water Resources Control Board is in charge of making sure that federal and state level quality standards of water are being upheld by these systems that are then giving the water to their constituents. And the way they do this is twofold. They require public water systems to monitor and report their water quality. And then if the water quality is out of compliance, if there's too much of some sort of contaminant in the water, they're required to fix it. So this is an egregious example, but we have a lot of cases of nitrate, arsenic, lead, uranium, and 1,2,3-TCP is another inorganic toxic chemical that's coming to the forefront of this conversation now. And it's something that I think we in Berkeley or the East Bay Area don't really think about too much. Now, so when a system gets a maximum contaminant level violation, a water quality violation, the solution is quite clear, right? Like there's data-driven understandings of what the risk of that exposure to that contaminant is, and what the community should do in response to that. For example, if there's a total coliform violation of some sort of bacteria, then a boil water notice might be sent out. But there's these other layers of inequities that are sort of buried in this system. For example, these letters might only be sent out in English, where these Spanish-speaking communities aren't able to read it at all, or maybe communities are told that they can't drink their tap water anymore. But then they have to resort to bottled water use for cooking, cleaning, bathing, drinking, and that could lead up to 10% of a household's income, which is close to triple what the UN at the international level thinks is an affordable rate. So where are we at now? We're at a point where we hopefully realize that drinking water is a human right. We want to assess how well systems are doing in extending this human right. And we realize that this system of violations, monitoring and reporting violations, and quality violations is really important. But the issue in California is that because of the way the system is set up, maybe a water quality violation might have a very clear and immediate solution. But monitoring and reporting violations are often left to accumulate and ignored. And the problem with this is that, one, these happen very often in more disenfranchised systems, again, clustered in the Central Valley. And the people who are drinking that water often don't know the quality of their water. They don't even know that there's a monitoring and reporting violation going on. So there's a risk of continued exposure to a contaminant that the state doesn't know about, that the people drinking the water don't know about. So what I am doing in my work right now is to approach this from a statewide level by looking at, or by trying to see if we could use statistical methods to predict which of these systems that are currently receiving monitoring and reporting violations are actually quite likely to also be in violation of water quality standards as well. And the hope of this isn't to point out which systems are bad actors or which systems ought to be punished, but more the hope is that we could connect these most disenfranchised systems that aren't able to do anything about their status quo with state resources and state funding that will hopefully improve their water quality condition. Thank you.
all so much. Any questions for our 4 panelists? All right, I will start with Bernadette. I would love to find out a little bit more about what your long-term plans are for your program and organization and what you need to help that thrive.
Yeah, thank you so much for asking that question. So the art exhibition is still up, Lucky Duck Bicycle Cafe near 12th Street Bar. Please check it out. And it'll be there until January 2019. We're actually going to have a huge launch party, really, and a celebration there in terms of gathering young women of color at this event, and with the upcoming elections, gathering city council members, community organizations, and other public leaders of influence into this sphere to really hear from the voices of young women themselves. And it's really a huge part and impact that this is going to be at the public library, because this will just be a reminder of what we need to center as we move forward in this political process.
Anything else? Yeah.
How did you find your participants?
Yeah, and so the question was, how did I find my participants? I have thankfully been embedded in an amazing, Oakland is an amazing hub of community health and community activism. And so my specific program was located in Chinatown, and so I worked intimately with Asian Health Services and Bantai Sui there. But also I just gained a lot of coalition work and was able to attend a lot of community events that also was able to really outreach to the Hispanic Latinx population as well as the African American communities of Oakland. And so that really created a dynamic group of girls who for some reason actually have never really been in that space together. And so it was very revolutionary for a lot of those girls to reveal that we all are all going through the same thing.
Yes.
Question for Sam. So you mentioned briefly, and maybe I missed it, but you mentioned briefly about the surveillance helping for understanding the health issues. Who's doing the surveillance that the organization you're working with uses?
So is it like how the system works essentially, the surveillance system?
Yeah, like, yeah.
So essentially what happens is, that's a really good question. So what happens is the organization I was working with acts as kind of like a hub. They just coordinate. And there's a lot of healthcare centers and hospitals inside of Syria that have started collecting data. So they'll collect case counts essentially of different infectious diseases. And that will then get referred to as like a local manager who will go out and collect all this information on a weekly basis. And then they'll send it to a regional center. And that regional center will then like aggregate all that data and then send it back to Gaziantep, which will then push out these reports and do analyses on these things.
Yes, Tom.
I have a question for Peter. Are the companies that offer or that control the detention centers public corporations or private corporations, so that some of Sophie Pearl's activities could influence them?
That's a great question. And the example I gave, I think I had the Core Civic logo up there and the layout was just the Otay Mesa Detention Center. So that's managed by a private for-profit company, but different detention centers are managed in different ways. So there could be opportunities there, and that's a really good point.
Yes, I have a question to say. I was just like not sure, like what is the reason for such a diversity in water supplies? I mean, who's in charge of this? So is it the whole of the state? Is it the companies? I mean, who's in charge of all this infrastructure, and who should monitor it exactly?
Yeah, so in the case of California, there's thousands of water systems. It depends on how you classify them, but if you look at public water systems that serve at least 25 people, 15 connections for 60 or more days of the year, there's about 7,500 of them. And that would include everything from something as big as LADWP or EB Mud that services us, down to, say, a trailer park or a school in its own private well system. So it's super decentralized, and they basically act as special districts for the most part, where they serve their constituency. And in terms of the infrastructure, the idea is that through their ratepayer system, they're supposed to be managing some sort of financial sustainability. which isn't the case or the reality in most of these systems. So you run into issues of non-compliance where the system is just, there's no way for it to be viable because the people who live there can't pay for these fixes, which is where the state has to come in.
I'm getting signals before I take another question that it's hard for people in the back to hear. So just a reminder, if you get a chance or if you think of it, to repeat the question and to just project as much as you can would be fantastic. Mary?
Question for Seigi. I have one question for you and then one for the other two. Where do you get the water tested? Is there a place where anybody can go to have their tap water tested? And for Bernadette, how does the young women feel about law enforcement and how do they cope? And for Pieter, I wanted to know if there are any minors whose families are being separated at that detention center. If the children are being treated.
Okay, so the question was about water monitoring. Is this on a household level, an individual
Yes,
level? Or?
can anybody just go, is there a lab where anyone can take their tap water to be tested?
So that depends on where you live, and some counties do have programs in place, usually driven through their departments of public health, that might be doing some sort of campaign to try to get people to test their water, especially private well water, actually. So I mentioned that public water systems are defined to service at least 25 or more people, which means that everything below that or smaller than that is completely unregulated by California. So there's this big issue and this big gap right now of people who use their own well water who actually end up being on the poor end of this, or the less wealthy end of the spectrum, who need to know what their water quality is. In terms of, on a personal level, there are kits that are surfacing up, but they still cost maybe a couple $100 to, send your own water quality.
Were there three questions?
The second.
Oh, sorry, no, you go ahead. Go ahead.
The question was, for me, how do the girls feel about law enforcement? And there were a diversity of viewpoints on this, but one of the demands worded very specifically was that they wanted community-based protection and safety. And so law enforcement has a very complicated relationship for communities of color in Oakland, and that is definitely an acknowledged thing within our dialogue and discussion. And so we were trying to imagine different ways that community groups and different salient people of influence in the community can actually form movements of solidarity within neighborhoods to actually work in conjunction with law enforcement to really protect neighborhoods.
To repeat the question, it was, do these experiences reflect those of children, and were any children detained in that detention center that I showed? And the short answer is no. The Otay Mesa Detention Center is adults only. And while it would be really interesting to look at the experiences of children, my research is done through the the IRB at UCSD, and for certain reasons, it's specifically for those aged 18 and up. There's special protections placed on doing research with minors, which I think in this case is very appropriate. I have training in qualitative interviews, but I think to engage in research with a minor population who have had these experiences probably takes someone with a little more experience working with children who have been exposed to trauma, and the methods probably could have been applied in a more appropriate way for the people with those specialties. I've actually spoken with a couple of faculty advisors at UCSD, and we're actually thinking about potential next steps in the future in this line of research. And one idea we've explored is working with people who have experience talking to children. And then just kind of one more point. So the people who I interviewed have gone through this entire process. So their journey started years ago, and as we all know, this summer there's been a lot of attention toward Trump's zero tolerance policy at the border and the issue of family separation. So most of the men I spoke with who experienced family separation, that's kind of been a long-standing policy. Men have historically been separated from their kids systematically, and of course that the implementation of that policy in children with their mothers has changed a lot this summer. So the way in which my project shaped up was really interesting with all the stuff that happened this summer, but it also because I was approaching it from a research point of view through the institution's human subject research protection support, I only spoke with adult men and women.
Other questions? Yes.
I got a question for Sammy. The surveillance is really concerning with the reoccurrence of polio in Syria. My question is there from a political standpoint, for a vaccination campaign, politically in the communities, which appear to be mostly in rebel-controlled areas, are the communities receptive to, or is there the ability to roll out a vaccination campaign?
Yeah, that's a really good question. So the question was there any like hesitation, resistance to vaccination, or openness to vaccination in these territories? And so it's a really complicated relationship. So there's been some kind of like mishaps that have happened. For example, in 2014, I believe, there was one community, there was one hospital that actually made a mistake in labeling the vaccination, and so they actually gave them like a muscle relaxant to infants, and 14 kids died actually from that situation. And so that news spread like wildfire, and so a lot of communities have actually developed mistrust in these settings. And also obviously because people don't have a lot of hesitancy to go to healthcare centers to begin with. So there's a lot of hesitancy, not just with vaccination efforts, but also with just like going to healthcare settings in general, because they feel like they're going to become a target, or there could be spies. So it's like a really complex situation, but there's been also a lot of people at the local level from grassroots trying to spread the word about vaccination and the importance in obviously like the family health, community health, but also as like a resistance effort. And so it's obviously a very complicated relationship, but I think so far they've had a lot of success in doing mass vaccination campaigns. It's kind of the more routine vaccination that's been having a lot of trouble and difficulty.
Other questions? Okay, well please join me in thanking our panel.